Hi guys, welcome to my channel. I am so happy you came to see me here today. I'm Dr. Hampton. If you're new to my channel, I call myself the Metabolic Health Doc, and I do that because I'm on a mission to help you achieve metabolic health. Today I wanted to give you some insights about a medical condition that has a very high mortality rate. You absolutely must stick to the end of this video because you need to know this information, because if you have been exposed to this illness, it can definitely be lethal. Today, we're going to talk about what it is, how you can get tested for it, and at the end, we're going to talk about what you can do to prevent it. So let's get started by describing what we're talking about. It's called an abdominal aortic aneurysm, and typically your aorta has a diameter of 1.8 to 2 or so centimeters. But if it gets greater than that size, 50% or so greater, you're at risk for a rupture. We don't want that. So that's anything over 3.0 centimeters in diameter or more. And what you find is that in our older population, they've been around for a while, and maybe their arteries are not as strong as they should be. It's about 2 to 5% of them that are at risk for this. It's very common because it's the 13th leading cause of death in the United States. And for men, it's the 10th leading cause of death. So it's kind of a big deal. One of the big risk factors is just having plaques in your arteries. We call it atherosclerosis. But the other risk factor, and probably the most important, is smoking. So it's important that now we have another reason why we shouldn't smoke. So if you're struggling with that, work with your clinician to reduce your risk for smoking. So let's distinguish real quick the difference between an aneurysm and a dissection of a blood vessel. So an aneurysm, as you can see, is when the diameter, as I've mentioned before, it gets a little larger, greater than 50% of what it should be, where a dissection is completely different. What happens here is that you have an additional lumen where blood can collect and where a rupture can occur. So it's an additional lumen. You have a false and a true lumen, and that false lumen can put you at risk. So just wanted to distinguish. I want to speak a little bit about this mortality rate. And this mortality rate is really important to understand. So here's an article from the European Journal of Vascular and Endovascular Surgery. And they did a meta-analysis on, mortality of rupture with we call it a triple A. And what you find is that the mortality rate in this particular study was 80 to 90%, which is shocking, if you think about it. So when you think about that 5.6 to 7.5 out of 1,000 people per year in Western countries who can get it, if you get it, it can be a big problem. So let's look at the USPSTF. This is the organization that helps us make recommendations. You'll see me mention that in videos in the future. And what we use them for is to give us a sense as a clinician, what should I do when I have a patient in front of me? So as you can imagine, you need to know who needs to get this test. And if you're a man over the age of 65 and you've ever smoked, they recommend that you do have a screening for this test starting at around 65 years of age. Now, if you're a man in the same age who has never smoked, you can selectively think about this with your clinician. It may still make sense for you, but it's not necessarily a routine thing. So if you feel like you're high risk, you have a lot of medical conditions, totally okay to do that. Now, for women who've never smoked and don't have a family history of a AAA, they're recommending that you don't bother. And the reason why is because they've looked at the data, and what they find, there's no difference between a person who gets screened, who doesn't get screened. Doesn't really help. And we tend to think in terms of, if we screen the whole population, does it make sense? For this particular test, for that particular demographic, it doesn't make sense. And finally, if you're a woman who have ever smoked and you have a family history for a AAA, in that setting, you may want to consider it. They're saying there's insufficient evidence to say everybody should be screened. But this is a conversation I think I would have with my doctor. And the reason why is partly because if you think about it, Medicare covers it. So if you're a woman who has a family history where you've ever been in that scenario, you may want to go ahead and talk to your doctor about it. And of course, men who have ever smoked, and the definition they use with Medicare is over 100 cigarettes or more in your entire lifetime, which that'll mean a lot of people, because back in the day, a lot of people were smoking. So this illustration in front of you just gives you a sense of, what's the chances that there's going to be a rupture, right? That's an important question to ask. And as you can see, if it's less than 4 centimeters, it's not likely going to happen, right? 1% up to about 4.9 centimeters. But when you get into the above 5 range, you can see your risk of rupture goes up 1 to 11%. And then when you're over 6, it's much higher. So those are the ranges where we start thinking about surgery. And as you can see, we're typically thinking about surgery when it's 5.5 centimeters or more. Okay, these are decisions you make with the vascular doctor and your primary care doctor as a team, but you want to make sure you're just kind of aware of this. And what do I do if I get diagnosed? I do the screening test. It's over 3 centimeters. I'm probably going to check it out if it's over 3 centimeters up to about 3.9 every 3 years. Going to just have another ultrasound. It's a non-invasive test, no big deal. If I'm 4 to 4.9 every year, and then of course if it's over 5, you're going to do it more often. And the reason why it's different for all these different sizes is because when it's 3, the rate of expansion, the rate of that diameter getting wider is going to be much slower. But as it gets bigger, the rate of increased diameter and risk for rupture gets higher. So that's why there's a difference, guys. So now you've come to this video, you're aware of this test. What can you do to prevent it? Well, number one, you gotta stop smoking, right? So if you're a smoker and you've struggled with smoker, you already know smoking is not a great thing. Now you have one more reason to eliminate smoking out of your life. So I would definitely move in the direction of smoking. We spend a lot of time on this channel talking about diet. So if you are interested in improving your diet, there's many ways to do it. We tend to promote low carb, keto, or carnivore. And the reason why is because I think the risk of atherosclerosis and vascular disease is greatest when you have a high consumption of carbs, and that leads to hyperinsulinemia, insulin resistance, vascular constriction, the influx of calcium, the influx of too much salt, inflammation with the macrophages, culminating in a blood pressure that's high, culminating in arterial lesions, and finally cardiovascular disease. And I put this diagnosis in that bucket. And finally, we want to move. We don't want to go crazy with exercise, but you should be a exerciser. Everybody should exercise. That's just a basic reality for humans to keep them healthy. We got to keep the stress down too, guys. If we reduce the stress, less constriction, less inflammation, less lesions in our arteries, and less of a chance to get a abdominal aortic aneurysm. So I really hope the insights into a triple A has provided some guidance, some tools for your brain, so you'll know, maybe for myself or that uncle, that grandfather, people in your lives who need to know about this test. So make sure they check out this video if they are curious about this. But more importantly, this is just another step to help us protect our nest to be healthy, because we now know that this is something that can happen to any of us. So I'm happy you came to this video. Like, subscribe, share, and until the next video with the Metabolic Health Doc, continue to be safe, be well, and continue to protect your nest.